Hi, I'm Dr. Talia Shafir. I'm a Master Somatic Movement Educator and Therapist and a Somatic Psychologist. I am basically the bridge between somatic psychology and somatics. And you will find that many of the traditional therapists who take trauma courses and are now aware of somatic psychology are not aware that somatics is something a little different. The advantage we have in the somatics field is that we understand the concept of creating a whole picture through movement before the talking begins. We basically are aware of how we organize movement, which is directly connected to how we organize thoughts. So what's the difference here between somatics, doing somatic movement therapy, and doing psychotherapy, somatic psychology? We take the movement and the context of the narrative and we put them together. So what I'm going to demonstrate today is something that I use as an add-on to doing trauma therapy, somatic trauma therapy, whether I'm actually, doing some sensory motor psychotherapy or somatic experiencing. And there's one piece of this that doesn't often get addressed, and that is what happens when I'm done doing the trauma therapy. What happens when the trauma has been processed? Where do we go from there? And this is particularly where somatics makes a difference. So I'm going to do one small example. Normally, when someone is stuck in a trauma field, there's often dissociation between limbs and the core. And so the question is, how do we begin to connect, make subcortical connections again between the spine, the limbs, including legs, and the narrative that expresses itself often in kind of a collapse, in a hollowing, in a giving up, and breathing quality, which of course is affected if you're going to be bent over like this. Your lungs cannot expand. So what do? Well, we go back developmentally to a stage that happens between approximately 8 months and 2.5 years. And we can call that the autonomy stage, and I borrow this from BodyMind, a somatic practice, somatic psychology practice. And what's going on? Because we develop psychologically and physically in parallel. So what's going on is a muscle called the quadratus laborum, and that's that muscle right here. Well, if you have ever seen a baby be lifted, right there, and they feel safe and contained, but what does the quadratus laborum do? Well, it is very, very central to crawling. So if you just lift your arm, you can feel that muscle. So what happens? And what has that got to do psychologically with an adult? Well, often we feel when we have come through a trauma that has stopped us in our lives and convinced us in some way that we can't reach our goals. So I'm going to demonstrate reaching and changing the quality and the narrative of the reach. very often there will be a holding here. And I will ask the client, well, where does your arm begin? Very often they say right here. And I regale them with breaking news that begins actually in your scapula. And we begin to reach. And so I'll hold something out and I'll say, okay, reach, just the way you are. And they'll do this. And they're holding. And I'll say, all right. And I'll come around and I may put a hand and trace the scapula of one side, or ask them to just move a shoulder and then follow the movement with their arm. And then I say, okay, you're going to reach, and I'm holding the object, or I let them pick an object. And I say, start with that scapula, start with your shoulder blade and reach out. Feel your body, feel that muscle. Oh, I can reach it now. Grasp it, bring it back, and you're going to bring it back leading with the way you began. And then you can let it go. And then I draw attention to the empty hand and I say, now there is space to explore more. So go ahead and explore. And I have them look around the room. We're going to do the other arm. Now we're going to organize from that shoulder blade. Look at how it extends your reach. And we bring it back. And then just for comparison's sake, I say, okay, we're going to start with your fingertips. So I want you to focus on your fingertips and see what happens. Oh, that's a little different. Okay, but then maybe I can use that. So now they're starting to explore their body and connect with their spine, which I bring to their attention after we've done this, after they've had an experience. So what am I doing? What has this got to do with trauma recovery? We're talking about restoring safety and the exploratory joy of reaching out and being able to set goals and reach for them. It's just one of the many ways that somatics and somatic movement therapy can be combined with the psychological aspect of any somatic therapy. Thank you.